Long-term carnivores are testing low on folate, also known as vitamin B9. Keep watching so you don't fall into this trap if you are following a carnivore diet, and especially if you're planning to follow it for an extended period of time. Hi, I'm Dr. Sarah Zaldivar, and I was featured on the first ever carnivore documentary called Reverse TV series. I've also lost and maintained 35 pounds despite struggling with my weight from a very young age. I've also quit my nutrition professor jobs at the University of Miami-Dade College, and the American College of Sports Medicine so I could reach a wider audience online, and I've coached thousands of clients so far into better health and fitness. Alright, let's start with why you don't want to develop a folate deficiency on a carnivore diet. First, the most devastating effect of a folate deficiency is for women who might be pregnant or who are breastfeeding. If you are planning to be pregnant or you are pregnant right now, there's a very high chance that a folate deficiency could lead to neural tube defects in the newborn. This is why gynecologists will always recommend a folic acid supplement, but I don't recommend that you take the synthetic version because in half the population that does not actually work, but that's a whole other topic for a different video. And if you're a breastfeeding woman, you have higher folate needs as well, and so if you're following a carnivore diet in a way where you're creating a folate deficiency and your needs are higher, this is also a recipe for disaster. What about for the rest of us? If we're not pregnant or breastfeeding, why would we care about a folate deficiency? A folate deficiency could cause fatigue, anemia, cognitive decline, depression, diarrhea, and other gut issues like ulcers. This is why if I'm troubleshooting a carnivore case with someone, I also make sure that I look for their folate status to ensure that their gut issues aren't really being driven by a folate deficiency. I will usually order the SpectraCell nutrient profile because it's one test and it checks for all their vitamins and all of their nutrients and also additional nutrients that they might be deficient in. And so it's an all-in-one test that really speeds up the process of figuring out the causes of why somebody might not be thriving on a carnivore diet. If you're curious or you want to test yourself for all these things, you can also check out the SpectraCell. It's going to be linked in the description box below. The mental health aspects of a folate deficiency can be pretty severe, so you can have a lot of depression, irritability, mood disorders, forgetfulness, ADHD type tendencies and poor concentration, and eventually cognitive decline over time. Not only that, but a folate deficiency will also raise levels of homocysteine, and a high level of homocysteine is closely related to a very high risk of heart disease. Alright, how much folate do you need? The recommendation is 400 micrograms of folate or dietary folate equivalents per day. The reason why a lot of carnivores are testing low on folate is because they're not including liver and enough organ supplements or organ foods in their diet. So all you really need is to include liver, specifically beef and chicken. Pork liver is also pretty good, but beef and chicken are the two richest food sources of folate on a carnivore diet. Now, I personally really dislike the taste of organ meats, even though I used to have it back in the day, but I used to have it with bread or caramelized onions. And so unless you want to bathe it in something like that to mask the taste, I personally don't like to just eat it like that, and so I supplement with ancestral supplements. That way you just take desiccated organ supplement and you don't really taste anything. If you are like me, check them out and you can use code Dr. Sarah to get 15% off on ancestralsupplements.com. Now, egg yolks and fish and shellfish also contain some folate on a carnivore diet, but they're far less concentrated in folate as compared to liver. You really are only gonna run into issues if all you're eating is just muscle meat. If you're only eating a ribeye steak every day, or like you're on the lion diet, that's really where we have an issue because you're not having a variety of foods and you're not consuming organ meats. So remember, we said it's 400 micrograms of folate that you need per day. Look at how much folate you can get from just a small amount of liver. Specifically, 3.5 ounces of chicken liver is going to give you 560 micrograms of folate. Beef liver and pork liver also are super high. A 3.5 ounce beef liver or pork liver will give you 290 micrograms. One whole egg has 47 micrograms. 3.5 ounces of salmon is gonna give you 25 to 30 micrograms, and 3.5 ounces of shrimp will give you 20 micrograms of folate. So in short, a muscle meat only carnivore diet is a little bit problematic because it could lead to a folate deficiency over time. I'm gonna give you a sample one-day meal plan on a carnivore diet that includes enough folate so you're not worried about developing a folate deficiency. You can start off at breakfast with eating 3 whole eggs and 3 yolks, scrambled or fried, plus 30 grams, in other words, an ounce of beef liver. You can finely chop it into the scramble or have it as a side, or you can just have the organ supplements. That's gonna give you 150 to 200 micrograms of folate. For lunch, you can have 5.3 ounces or 150 grams of ribeye steak with 50 grams or 1.5 ounces of chicken liver, and that will give you 120 to 150 micrograms of folate. As a snack, you can have 2.8 ounces of canned salmon or mackerel with 1 boiled egg, and that's gonna give you 30 to 40 micrograms of folate. For dinner, you can have around 5.3 ounces of tenderloin or ground beef or 150 grams of ground beef and 1.5 ounces of lamb kidney or beef kidney, and that's gonna give you 80 to 100 micrograms of folate. So in total, this sample meal plan just gave us the recommended amount of folate, which is 400 micrograms. So if you're like me and you're not a big fan of organ meats, definitely make sure you're paying close attention to your blood work to ensure that you're not developing a folate deficiency, because especially the mental aspect for me is something that I'm always fine-tuning, and I always wanna make sure that I'm not creating these deficiencies that are leading to depressive moods or just low energy and forgetfulness. And if you want to learn more about the carnivore diet, I will send you a free copy of my guide, the 30-day Carnivore Diet Challenge Guide, when you sign up to my newsletter at drsarahzaldivar.com/newsletter. And if you're interested in one-on-one coaching, check out my packages at drsarahzaldivar.com/coaching, and you can use code YouTube to give you 50% off all my coaching packages within the next 48 hours. I hope this was helpful. If you enjoyed this kind of content, let me know in the comment section below. If you have any questions as well, drop them below. I go over all my comments and I answer all of them. And make sure you give this YouTube video a thumbs up if you liked it. Hit that little notification bell icon so YouTube alerts you every time I post a new video. And I will see you in the next one.